If your legs have started to feel heavy after 60, you have probably been told the same thing I have heard 1,000 times in my exam room, that it is just part of getting older, that everyone slows down, that there is nothing to be done. That is wrong, completely wrong. And the wrongness of that advice is part of the reason so many seniors give up on their own bodies far earlier than they ever needed to. Heavy legs are not a normal feature of aging. They are a symptom. And in 20 years of treating muscle loss in older adults, I have learned that this particular symptom has 3 specific causes that nearly every senior experiences in some combination. Once you understand which one is driving your heavy legs, the fix is often surprisingly fast. Most of my patients feel a meaningful difference within 14 days. I am Dr. Cecilia Grant, sarcopenia specialist. After 20 years in practice, I have stopped being polite about the myths that are quietly weakening my senior patients. Today I am going to bust one of the most damaging ones. The myth that heavy legs are just something seniors have to live with. Let us look at what is actually happening and what to do about it. First, let me tell you exactly what we mean by heavy legs. Because the term gets used loosely. Heavy legs is the feeling that your legs require visible effort to move. Stairs feel harder than they used to. Standing from a seated position feels like lifting weights. Walking from one room to the next requires you to think about it. Sometimes the legs feel almost waterlogged, dense, dragging. You sit down at the end of the day and you feel them, in a way you never used to feel them. This is not normal. Healthy legs do not feel heavy. Healthy legs disappear into the background of your day the way they did when you were younger. If your legs have become noisy, if they are demanding your attention, if they are reminding you they are there every time you move, your body is sending you a signal. Your job is to read the signal, not to ignore it. So let us go through the 3 real causes I see in my sarcopenia clinic in order from least to most common. Because number 1, poor circulation. This is the cause most seniors and most doctors land on first. The blood is not flowing through the legs efficiently. The legs ache, they swell, they feel tired by the end of the day. Sometimes they feel cold to the touch. If your heavy legs come with visible swelling around the ankles, varicose veins, skin discoloration, or notable temperature differences between your legs, please talk to your own doctor. Circulation problems in older adults can be straightforward to manage, but only your physician can evaluate your specific case. They may want to check your peripheral pulses, your vein health, or run other tests that only they can interpret. But here's what I have observed in 20 years of practice. Pure circulation problems account for maybe 20% of senior heavy leg complaints. Most seniors who come in convinced their heavy legs are about circulation are actually dealing with one of the next 2 causes. Because number 2, dehydration and electrolyte imbalance. This one surprises people every time. Seniors do not drink enough water. They simply do not. The sensation of thirst becomes blunted with age. Many seniors have been deliberately reducing their fluid intake for years to avoid waking up at night to use the bathroom. Some take medications that further reduce fluid retention. The result is a body that is chronically running on slightly too little water. And when a body runs on too little water, the muscles, especially the large muscles of the legs, lose performance dramatically. A muscle is roughly 75% water. Take away even a small percentage of that hydration, and the muscle becomes less responsive, slower to fire, and slower to recover between movements. The senior feels this as heaviness, sluggishness. Their legs simply do not respond the way they used to because they are operating on a fraction of the fluid they need. The same applies to electrolytes. Sodium, potassium, and magnesium are the minerals that allow your muscles to contract properly. Many seniors, especially those on water pills or following strict low-sodium diets, are running low on one or more of these minerals every single day. The legs are usually the first place this shortage shows up because the legs are the biggest muscle groups in the body. I have personally seen heavy legs disappear in patients within 4 or 5 days, just from drinking more water and slightly increasing their electrolyte intake. No exercise, no supplements, no medications, just basic hydration and basic minerals in the right amount. Of course, please talk to your own doctor before changing your fluid or sodium intake, especially if you have heart, kidney, or blood pressure conditions. They are the only person who can tell you what the right amount of fluid and minerals is for your individual body. Before I move to the 3rd and most common cause, I want to pause and ask you something. Because in 20 years of treating heavy legs, I have noticed that when your legs feel heaviest is often a powerful clue about what is actually causing it. Tell me in the comments, when during your day do your legs feel the heaviest? Is it in the morning when you first get out of bed? Is it midday when you have been standing or walking around? Or is it in the evening after a full day when you finally sit down? Each timing tells me something different about your specific situation. There is no wrong answer. I read every comment, and honestly, knowing when your legs feel worst helps me make more useful videos for everyone watching. Now, the third cause, the one that affects the most seniors, the one that is most often missed. Cause number 3, sarcopenia. Heavy legs are one of the earliest and most common physical signals of muscle loss in older adults. And it makes perfect sense once you understand what is actually happening inside the leg. The large muscles of your thighs, your quadriceps, and your hamstrings, along with your hip flexors and your calves, are not just there to move you around. They are there to do that work with reserve, with margin, with effortlessness. When those muscles are at full strength, climbing a flight of stairs feels like nothing. Standing from a chair feels like nothing. Walking across a parking lot feels like nothing. But as those muscles shrink with age and inactivity, the same movements start to require near maximum effort. A muscle at 50% of its former size has to work twice as hard to do the same task. A muscle at 30% of its former size has to work 3 times as hard. The movements that used to be background noise become foreground demands. And the senior feels this exactly the way you would expect, as heaviness. Heavy legs, in other words, are very often a way of saying, my legs no longer have any reserve. Every step is now near my limit. This is sarcopenia talking. And it is the most common cause of senior heavy legs that I see in my clinic. Far more common than circulation issues, often coexisting with mild dehydration. So here's the simple plan I give my patients to address heavy legs in 14 days. We address all 3 potential causes in parallel because almost every senior has at least 2 of them contributing. Day 1 through 14. Hydration first. Drink at least 64 ounces of plain water per day, spread out, not gulped. That is 8 cups. Most seniors are drinking half of this. Start measuring. Use a marked water bottle if it helps you track. If your doctor has cleared you, lightly salt your food at 1 meal a day or have a small serving of broth at lunch. Many seniors are unknowingly running low on sodium. Day 1 through 14. Move the legs every 2 hours. This is not exercise. This is movement. Every 2 hours during your waking day, stand up, do 10 gentle marching steps in place, 10 ankle circles in each direction, and 10 slow rises onto your toes. Sit back down. That is 1 set. 3 minutes every 2 hours. This pumps blood through the legs, activates the muscles, and prevents the daily slump that makes evening heaviness so much worse. Day 1 through 14. 2 short strength sessions per week. Twice a week, 10 minutes each, do 4 simple movements. 5 chair stands slowly. 5 chair stands with a slight pause at the bottom. 10 slow heel raises against a counter for support. And 10 very slow knee extensions while seated, lifting each foot straight out in front of you until your leg is parallel to the floor, then lowering it back down with control. That is the program. Hydration. Hourly movement. 2 strength sessions per week. 14 days. In my clinic, the vast majority of senior patients with chronic heavy leg sensation report meaningful improvement in this exact window. Some feel dramatic differences within 4 or 5 days, mostly from the hydration changes alone. Most feel a clear shift by day 14. The few who do not are usually the ones with a real circulation issue, which is why I always send those patients to their own physician for proper evaluation. Please remember, this is a general framework based on what I have seen work for many seniors. Your situation may be different. If you have severe swelling, sharp pain, numbness, color changes in your legs, or any sudden new symptom, please see your own doctor right away. Heavy legs are usually about muscle and hydration, but certain serious conditions can also cause them, and only your physician can rule those out. So here is what I want you to take from this video. Heavy legs are not a normal feature of aging. They are a signal. In most seniors, that signal is some combination of mild dehydration and quiet, ongoing muscle loss. Both are fixable, often within 2 weeks, with nothing more complicated than water, movement, and a few minutes of strength work twice a week. You do not have to accept heavy legs. You do not have to slow down because everyone else your age slowed down. You do not have to give up the stairs. You do not have to plan your day around how heavy your legs will feel by 3 in the afternoon. There is another option, and it costs nothing to try. If this video helped you see your heavy legs differently, please give it a like. It is a small thing, but it helps me reach more seniors who have been told there is nothing to be done. And if you would like to stay strong, stay mobile, and stay independent for as long as possible, please subscribe to the channel. I post new videos every week, sharing what I have learned in 3 decades of medicine and 20 years specializing in muscle health, so seniors like you do not have to figure this out alone. One last thing. If you know someone over 60 whose legs have started to feel heavy and who has been brushing it off as just aging, please share this video with them. Sometimes the right explanation at the right time is the difference between accepting decline and turning it around.